CEN Written Exams Questions and Answers. Question 1. Which of the following is a clinical feature of a pulmonary contusion? Option A. Hemoptysis. Option B. Chest wall crepitus. Option C. Subcutaneous emphysema. Option D. Unilateral wheezing. The correct answer is option A. Hemoptysis. Pulmonary contusion, bruising of lung tissue, often results from blunt chest trauma. Clinical features include hemoptysis, hypoxia, and opacities on chest X-ray that develop over 24 to 48 hours. Chest wall crepitus and subcutaneous emphysema suggest pneumothorax or rib fracture. Unilateral wheezing suggests a foreign body or bronchial obstruction. Treatment is supportive with oxygen and pain control. Question 2. A patient with a suspected fracture has a pulse that is absent. The CEN should: Option A. Apply a splint and reassess. Option B. Apply a tourniquet. Option C. Reduce the fracture. Option D. Call for an orthopedic consult. The correct answer is option A. Apply a splint and reassess. If a fracture is suspected and the pulse is absent, the CEN should apply a splint to align the bone and reassess the pulse. If the pulse returns, the circulation is likely adequate. If the pulse remains absent, it may indicate arterial injury, requiring an orthopedic and vascular consult. Tourniquets are for bleeding control, not for absent pulses. Reduction is done by a physician, not by the CEN. Question 3. Which of the following is a classic finding in a patient with pericarditis? Option A. ST segment elevation in all leads. Option B. PR segment depression. Option C. Chest pain that worsens with inspiration. Option D. All of the above. The correct answer is option D. All of the above. Pericarditis presents with diffuse ST segment elevation, often concave upward, PR segment depression, and chest pain that is pleuritic, worse with inspiration, and better leaning forward. It is often viral in origin. Treatment includes NSAIDs, colchicine, and steroids if refractory. Question 4. A patient with a history of opioid use disorder presents with respiratory depression and constricted pupils. Which medication should the CEN anticipate? Option A. Naloxone, Narcan, 0.4 mg 4. Option B. Flumazenol, Romazicon. Option C. Naltrexone. Option D. Buprenorphine. The correct answer is option A. Naloxone, Narcan, 0.4 mg 4. Naloxone is the opioid antagonist used to reverse opioid overdose, which presents with respiratory depression, pinpoint pupils, and decreased consciousness. The dose may be repeated if there is no response. Flumazenol is for benzodiazepine overdose. Naltrexone and buprenorphine are used for maintenance therapy, not reversal. Airway management is the priority. Question 5. A patient with a psychiatric emergency is being discharged. The CEN should: Option A. Provide a written crisis plan and resources. Option B. Schedule a follow-up appointment. Option C. Ensure the patient has a safe discharge plan. Option D. All of the above. The correct answer is option D. All of the above. Psychiatric discharge planning is an essential part of emergency nursing care. It includes providing a written crisis plan, referral to community resources, scheduling follow-up appointments, and ensuring a safe home environment. This is part of the professional issues domain, covering discharge planning, patient safety, and continuity of care. Question 6. Which imaging study is preferred for stroke evaluation within the first 24 hours? Option A. CT angiography, CTA. Option B. MRI with diffusion-weighted imaging, DWI. Option C. CT perfusion, CTP. Option D. All of the above depending on the clinical scenario. The correct answer is option D. All of the above depending on the clinical scenario. Stroke evaluation may include non-contrast CT to rule out hemorrhage, CTA to assess large vessel occlusion, CT perfusion to assess penumbra, and MRI-DWI for early infarction detection. The choice depends on the clinical scenario, time since last known well, and availability. For thrombectomy candidates, CTA is essential to assess vessel patency. Question 7. A patient with alcohol withdrawal presents with tremors, hypertension, tachycardia, and diaphoresis. The CEN should anticipate. Option A: benzodiazepines, lorazepam, chlordiazepoxide. Option B: antipsychotics. Option C: beta blockers. Option D: 4 fluids only. The correct answer is option A. Benzodiazepines, lorazepam, chlordiazepoxide. Benzodiazepines are the first-line treatment for alcohol withdrawal, reducing the risk of seizures and delirium tremens, DTs. They work by augmenting GABA, thus preventing sympathetic overdrive. Chlordiazepoxide, Librium, and lorazepam, Ativan, are commonly used. DTs are a medical emergency requiring ICU-level care. Antipsychotics and beta blockers are adjuncts or alternatives but not first-line. Question 8. A patient with a chemical burn to the skin should have the skin. Option A: neutralized with an acid or base. Option B: decontaminated with water. Option C: covered with a sterile dressing. Option D: treated with a topical antibiotic. The correct answer is option B. Decontaminated with water. Chemical burns require immediate decontamination with water, irrigation, for at least 15 to 20 minutes. Neutralization is not recommended because it can cause exothermic reactions, heat, or further tissue damage. The CEN should remove contaminated clothing and irrigate the skin thoroughly. This may be done before the patient arrives in the ED, pre-hospital. Question 9. A patient presents with heat stroke, temperature 40.5 degrees Celsius, 105 degrees Fahrenheit, confusion, and hot, dry skin. The priority intervention is Option A: 4 fluids. Option B: cooling measures, ice packs, cold water immersion. Option C: antipyretics, acetaminophen. Option D: neurological assessment. The correct answer is option B. Cooling measures, ice packs, cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. The priority is to lower the core temperature as quickly as possible using ice packs, cold water immersion, or evaporative cooling. Antipyretics are ineffective in heat stroke because the pathophysiology is not hypothalamic. Cooling should be done until the core temperature reaches 38.9 degrees Celsius, 102 degrees Fahrenheit. 4 fluids are supportive. Question 10. Which finding is classic for cardiac tamponade? Option A: widened pulse pressure. Option B: Beck's triad, hypotension, muffled heart sounds, JVD. Option C: Kussmaul's sign. Option D: pericardial friction rub. The correct answer is option B. Beck's triad, hypotension, muffled heart sounds, JVD. Beck's triad is the classic presentation of cardiac tamponade, hypotension, from decreased cardiac output, muffled heart sounds, fluid in pericardial sac, and jugular venous distension, impaired right heart filling. Other findings include pulsus paradoxus and electrical alternans on ECG. Emergent treatment is pericardiocentesis. Pericardial friction rub suggests pericarditis. Question 11. A patient presents with sudden, painless vision loss in one eye. Which diagnosis is most likely? Option A: central retinal artery occlusion, CRAO. Option B: retinal detachment. Option C: acute angle closure glaucoma. Option D: optic neuritis. The correct answer is option A. Central retinal artery occlusion, CRAO. CRAO presents with sudden, painless, monocular vision loss. It is an ophthalmic emergency requiring immediate evaluation for a source of emboli. The patient may have a cherry red spot on the macula. Treatment includes ocular massage, lowering intraocular pressure, IOP, and possibly thrombolysis if the patient is within the window. Retinal detachment presents with flashing lights and floaters. Question 12. A patient who is depressed and suicidal is admitted to the ED. The CEN should: Option A. Ask the patient if they have a plan to harm themselves. Option B. Avoid asking about suicide to prevent giving the patient ideas. Option C. Ask the patient only about feelings of hopelessness. Option D. Ask the patient about their mood. The correct answer is option A. Ask the patient if they have a plan to harm themselves. Asking about suicidal ideation and a specific plan is essential for risk assessment. It does not give the patient ideas but helps the healthcare team determine the level of risk and implement appropriate safety measures. Direct, non-judgmental questioning is recommended. Evaluation of intent, plan, and means is critical in assessing suicide risk. Question 13. A patient with cardiogenic shock has a cardiac index 2.2 L/min/m superscript 2 and elevated filling pressures. Which finding would the CEN expect? Option A. Warm, dry skin. Option B. Cool, clammy skin. Option C. Bounding pulses. Option D. Widened pulse pressure. The correct answer is option B. Cool, clammy skin. Cardiogenic shock is characterized by decreased cardiac output and increased systemic vascular resistance, SVR, resulting in cool, clammy skin, oliguria, and hypotension. This is in contrast to distributive shock, septic or neurogenic, where skin is warm and dry due to vasodilation. Management includes inotropic support, dobutamine, and vasopressors, norepinephrine. Question 14. A patient with a suspected pneumothorax has unilateral decreased breath sounds and tracheal deviation. The CEN should: Option A. Administer supplemental oxygen. Option B. Prepare for needle decompression. Option C. Obtain a chest X-ray. Option D. Place the patient in a supine position. The correct answer is option B. Prepare for needle decompression. Tracheal deviation with decreased breath sounds suggests attention pneumothorax, a life-threatening emergency requiring immediate needle decompression. Oxygen is given but does not treat the underlying pathology. Chest X-ray should not delay treatment. The patient should be positioned upright if possible. A supine position can make the diagnosis more difficult. Question 15. A patient with a crush injury to the lower extremity presents with pain, swelling, and dark urine, tea-colored. Which complication is the CEN most concerned about? Option A. Compartment syndrome. Option B. Rhabdomyolysis. Option C. Fat embolism. Option D. Infection. The correct answer is option B. Rhabdomyolysis. Crush injuries can lead to rhabdomyolysis, characterized by muscle breakdown and release of myoglobin, leading to dark, tea-colored urine, elevated creatinine kinase, and risk of acute kidney injury. Treatment includes aggressive forehydration, normal saline, alkalinization of urine with sodium bicarbonate, and possible dialysis. Compartment syndrome can also occur, but dark urine is a classic sign of rhabdomyolysis. Question 16. What is the chain of custody in the context of forensic evidence? Option A. The sequence of people who handle a sample, ensuring it is not tampered with. Option B. The chain of command in the ED. Option C. The medication administration record. Option D. The patient's medical records. The correct answer is option A. The sequence of people who handle a sample, ensuring it is not tampered with. The chain of custody is the documentation of every person who has handled a piece of evidence, e.g., blood, urine, clothing, from the time it is collected until it is presented in court. Maintaining the chain of custody ensures the evidence is not tampered with, lost, or contaminated. This is crucial in forensic cases, sexual assault, violence, etc. Question 17. A patient with a head injury has a GCS of 8. The CEN should: Option A. Intubate the patient. Option B. Elevate the head of the bed to 30 degrees. Option C. Administer mannitol. Option D. All of the above. The correct answer is option D. All of the above. A GCS 8 indicates severe head injury and a need for airway protection and management of elevated ICP. Intubation is indicated to protect the airway and manage ventilation. Head elevation to 30 degrees reduces ICP. Mannitol or hypertonic saline is used to reduce ICP. All interventions are indicated in severe head injury. Question 18. A patient with a dog bite wound presents with redness, swelling, and purulent drainage. The CEN should: Option A. Irrigate the wound and prescribe antibiotics. Option B. Culture the wound and start empirical antibiotics. Option C. Close the wound primarily. Option D. Apply a pressure dressing. The correct answer is option B. Culture the wound and start empirical antibiotics. Infected wounds, cellulitis, abscess, require cultures and antibiotics. Dog bites can be infected with Pasteurella, Capnocytophaga, and other organisms. Empirical antibiotics, amoxicillin clavulinate, are often started. The wound should be opened, drained, irrigated, and debrided. Primary closure is generally not recommended for infected wounds, they are left open for drainage. Question 19. A patient with a long bone fracture presents with severe pain out of proportion to the injury, swelling, and pallor. The patient has a cast. Which diagnosis should the CEN suspect? Option A. Compartment syndrome. Option B. Fat embolism. Option C. Osteomyelitis. Option D. DVT. The correct answer is option A. Compartment syndrome. Compartment syndrome is a surgical emergency characterized by pain out of proportion to the injury, pallor, pulselessness, paresthesia, and paralysis. The 6 Ps: pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia. It occurs when pressure within the compartment exceeds perfusion pressure, leading to ischemia and necrosis. Immediate fasciotomy is required to prevent irreversible damage. Question 20. A patient with a pulmonary embolus is receiving heparin. The CEN should monitor for which complication? Option A. Bleeding. Option B. Heparin-induced thrombocytopenia, HIT. Option C. Allergic reaction. Option D. All of the above. The correct answer is option D. All of the above. Heparin has multiple complications: bleeding, due to anticoagulation, HIT, immune-mediated thrombocytopenia, and allergic reactions. Monitoring includes APTT, for therapeutic effect, platelet count, for HIT, and bleeding assessments. HIT should be suspected if the platelet count drops significantly. Alternatives include direct thrombin inhibitors, argatroban, if HIT occurs. Question 21. A patient with suspected tuberculosis should be placed on which type of precautions? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option C. Airborne precautions. Tuberculosis is transmitted via airborne particles, droplet nuclei. Patients with suspected TB should be placed in an airborne infection isolation room, AIIR, with negative pressure. Staff should wear an N95 respirator or a powered air purifying respirator, PAPR. Contact and droplet precautions are for other types of infections. The patient should wear a mask during transport. Question 22. A patient with acute aortic dissection presents with a tearing chest pain radiating to the back. Which finding is most suggestive of this diagnosis? Option A, widened mediastinum on chest X-ray. Option B, blood pressure 180/110 mmHg. Option C, pulse deficit between arms. Option D, all of the above. The correct answer is option D, all of the above. Aortic dissection presents with tearing chest pain radiating to the back. Classic findings include a widened mediastinum on CXR, hypertension or hypotension if tamponade/rupture, and a pulse differential between arms, or blood pressure differential 20 mmHg. Key management includes blood pressure control, target systolic 100 to 120 mmHg, with beta blockers and emergent surgical consultation. Question 23. A patient presents with a severe headache, nausea, and vomiting. The patient has a history of hypertension. Which finding would suggest a subarachnoid hemorrhage? Option A, a sudden, severe headache, thunderclap, and nuchal rigidity. Option B, gradual onset headache. Option C, blurred vision and photophobia. Option D, focal neurological deficits. The correct answer is option A, a sudden, severe headache, thunderclap, and nuchal rigidity. Subarachnoid hemorrhage presents with a sudden, severe thunderclap headache, often described as the worst headache of my life. Nuchal rigidity, neck stiffness, is a classic finding. CT head is the initial diagnostic test. Gradual onset suggests a different etiology, e.g., migraine. Focal deficits may suggest an ischemic stroke or mass lesion. Question 24. What is the most common presenting symptom of acute coronary syndrome, ACS, in women? Option A, crushing substernal chest pain. Option B, atypical symptoms such as shortness of breath, nausea, and fatigue. Option C, radiating pain to the left arm. Option D, syncope. The correct answer is option B, atypical symptoms such as shortness of breath, nausea, and fatigue. Women, elderly, and diabetic patients often present with atypical symptoms of ACS, including shortness of breath, nausea, vomiting, fatigue, and epigastric discomfort, rather than classic crushing chest pain. This can lead to delayed recognition and treatment. Emergency nurses must maintain a high index of suspicion for atypical presentations. Question 25. A patient presents with sudden onset of right-sided weakness, facial droop, and aphasia. The last known well time was 3 hours ago. What is the priority action? Option A, obtain a stat CT head, non-contrast. Option B, administer aspirin 324 mg. Option C, start 4-alteplase, TPA. Option D, obtain an MRI. The correct answer is option A, obtain a stat CT head, non-contrast. This patient is having an acute ischemic stroke. The priority is a stat non-contrast CT head to rule out hemorrhage before administering TPA. The time window for 4-TPA is within 4.5 hours of last known well. This patient is within the window. However, CT must be done first to rule out hemorrhagic stroke, which is a contraindication to TPA. Aspirin may be given after TPA is ruled out.